comment, a public hearing around this. So, all right, so let's mute all of our phones, guys. All right. So thank you all for attending today's Health and Human Service committee meeting at 6 p.m. on HPA-TV Comcast and Frontier Government Channels 96 and 6032. They would also be streamed via hpa-tv.org, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It would also be rebroadcast and made available on the HPA-TV YouTube channel. So today I'll introduce everyone in the order that I see them. So first we have our newly appointed director, Director Jackson Shahid. We have voting member Councilwoman Marilyn Rossetti. We have Corporation Counsel Damar Osborne. We have my legislative liaison to City Council, Lydia Colon. We have our voting member, Councilman John Gale. We have our community catalyst, and no introduction needed, but I'll introduce her anyway, is Hyacinth Yenny. We have Sharon Mirzwa. All right, and you're here to talk about the ordinance, correct? Yes. All right, we have Advocacy to Legacy Zone, Violet Haldane. And we have 3 students that have been active on this ordinance from the beginning, and that is Devon Chambers, Akeem James, and Akeelia James. Thank you, scholars, should I say, for attending today's meeting. So we're going over the ordinance, which is an ordinance amendment for tobacco regulations. And the public hearing is going to be on Tuesday, June 20th. It was originally scheduled for Monday, June 19th, but my council colleagues and I pushed forward the Juneteenth as a holiday for the city, so we're very proud of that. And so we're moving it over to Tuesday, June 20th will be the public hearing. And so for the floor, I'll proceed to give the floor to we'll start off with you, Violet, and then you tee it off to the students.
Sure. Thank you for having us back. We have proposed that we have been doing work on tobacco for several years, maybe 5-6 years. We did work on Tobacco 21. We also tried to do work regarding banning flavored products, tobacco, nicotine products in the city. And we've been doing additional research. We were looking at retail density in the city of Hartford, and we looked at, we discovered a lot of things, but the only thing that seemed viable to move forward was to identify how close to schools tobacco products could be sold. We came up with the 500 feet because that is what the alcohol ordinance is right now. And we realized that right now in the state of Connecticut, there is no standard for that. And so each town has a different, distance, proximity, based on what they chose. But Hartford is 500 feet, and we chose that for our tobacco, nicotine, e-cigarettes, vaping products. And so that is what the kids will be speaking about today.
All right, fantastic. Ms. Violet, do you want to have any scholar in particular go first?
No, whoever is ready.
I'll go first.
Thanks.
Good afternoon. Hello, my name is Akeem James. I'm a graduating senior at Achievement First Hartford High School. My reasoning for coming today is to advocate for tobacco products not to be sold within a 500 feet radius from schools. This policy currently applies to alcohol, as Ms. Violet says, and so we're trying to apply it to tobacco products. So based on my research, according to the CDC, tobacco product use primarily starts during adolescence. The CDC also states that in 2022, about 4 of every 100 middle school students and about 1 of every 6 high school students reported current use of tobacco products. Creating a 500 feet distance between schools and tobacco products creating a 500 feet distance between schools and tobacco product selling stores could possibly decrease those statistics of young people smoking at early ages. The overall idea of this policy is to limit adolescent access to tobacco products. So when we're applying the 500 feet, um, would like move it further from schools and like recreational centers, like just to limit the access to it. Um, One thing I want people to realize is that the presence of tobacco is as impactful as it is when it's being used. So just the presence alone can create curiosity amongst adolescents, and like they would want to try the product if it's like around them all the time. Personally, growing up, my school was surrounded by tobacco selling stores. I would also smell the harshness of the tobacco when going to and from school. Even though the product was all around me, I never developed the curiosity to try the product. But that may be different for other younger people. I just want to try to limit I just want to try to limit the chances of young people adapting to smoking tobacco. Um, my name is Akeem James. I am in favor of creating a policy that limits the sale of tobacco products with a 500 feet radius of schools, and we are asking for support.
Thank you, Mr. James. Ms. Violet, anyone to go next?
Next.
Hello, good afternoon, guys. My name is Akeelia James. I'm 18 years old. I'm also a graduate senior from Achievement First Hartford High School. I'm here to speak to you guys about the tobacco proximity policy. This policy is to limit the sale or purchase of tobacco products 500 feet from the schools. This is important to me because as a person of color and whose community was and is still being targeted by tobacco product, it would be beneficial for the new generation of Black and brown kids to not have the products in their everyday life by seeing them as they go to school or their after school programs. Kids are at a very vulnerable stage in their life where they are easily influenced and have a high chance of using tobacco products. If they begin to use the tobacco products, they are prone to lung disease and brain problems. Tobacco products are also one of the major causes of death in the Black and brown communities because it causes heart disease, cancers, and strokes. Having the policy be put in place will decrease the possibility of kids purchasing tobacco products because it would be out of their reach. I'm in favor of this policy, which will limit the sales purchases of tobacco products 500 feet from any schools, recreational center, and I hope you guys would support. Thank you.
Thank you, Akeelia. Devon?
Hello, good afternoon, everyone. My name is Devon Chambers. I'm a senior. Actually, I'm not a senior in high school anymore. I finished high school. I finished high school at Achievement First, and I'm an advocate for my community. I'm here today. I am here speaking to you because as of today, there's no policy or law that forbids the selling of alcohol or tobacco or nicotine products in close proximity of schools and recreational centers. However, there is currently a policy that forbids the selling of alcohol within 500 feet of schools and recreational centers. I believe that this policy should be in place. The policy in place for alcohol should also be in effect for tobacco and nicotine products. This is important for the health of the community. When kids walk home from school or walk to school, they see gas stations, local convenience stores advertising these products while en route to their destination. This is specifically important to me because as I've grown up in Hartford, all my life I've been living in Hartford, and I see kids walking out of stores or walking into stores purchasing these products or using these products on the street. And that is not okay because it impacts the health of them and they don't even know it. It can impact them very long term. I work closely with some of the children during my summer youth employment at BHCA, and seeing them smoke is not okay. Not only is it unsafe, but it is mostly unhealthy for their bodies, limiting or terminating the selling of of tobacco products in close proximity of schools and recreational centers will not only benefit the children, but also the current health and future health of the community. I hope I am here today to ask for your support to enact this proximity policy for the better of Hartford as a whole. Thank you.
Devon, I believe you were also a student of mine at Achievement First, so I'm happy to see all of you guys on. Thank you, Miss Violet. Why don't we why don't we pause here and see if any of my council colleagues, do any of you guys have questions for the scholars or Miss Violet? Yes, Councilwoman Rossetti.
Well, I want to commend them. As someone who was a youth once and tragically a former smoker, or maybe good, I'm a former smoker, but I was a smoker. And it started young, you know what I mean? It was a lot of peer pressure. It was availability. It was seeing it. So I admire and I appreciate, to hear from people who are right there, and it's still an issue. And certainly it's dangerous. It's bad for us. It smells bad. There's a variety of things. So I commend you. I thank you, Ms. Violet, for organizing. And those are my comments.
Thank you, Councilwoman Rossetti. Councilman Gale.
Yeah, thank you, Mr. Chair. And I certainly second everything that Councilwoman Rossetti said. I'm just wondering if anybody is aware of opposition to this proposed ordinance, and what the base, since this is going to, if I understand it, this is going to grandfather in everybody that's currently there. So we're not going to stop anybody who's presently selling cigarettes, but it would prevent in the future from new stores opening up. Are you aware of this ordinance passing in any other town in Connecticut? And also, are you aware of any opposition and what the basis would be?
It has not passed or been brought forth in any other town in Connecticut. This is the first time. We purposely grandfathered existing stores because when we were doing research and we were looking at other towns to see if they had an ordinance, they did not, but some of them felt that it might be difficult in their particular towns. And that is why we chose to go with the alcohol distance versus trying to make it more restrictive. But we have not really gone out to see if there is going to be opposition because, as I said, we've been doing this work and we do know that the store owners are very interested because if you recall, many of them said if they could not sell flavored products, they would go out of business, which, we thought was very interesting since we thought stores were there to provide food and other products to the community, not tobacco products. But we do not know of any actual opposition at this time. We do know that we do have some advocates. We have talked with like Cancer Society, Lung Society, and the organizations that normally support this. And they will hopefully show up or at least sending some letters of support for when it goes for council vote.
Well, interesting. You've clearly been paying attention because you're referencing our former attempt to outlaw flavored
We spoke
tobacco
that.
products of all kinds, including menthol cigarettes. And you remember the large turnout that we had. And I agree with you. I was shocked at the statistics that some of the owners were maintaining that, as I recall, some of them said 40% of their business came from cigarette sales, which I found to be a bit of an exaggeration. But in any event, good for you for, coming up with another angle that further restricts these sales in any small way that we can. I think it's incredibly important, and I'm very supportive. I was a sponsor of Tobacco 21, our ordinance that raised the age to 21. And my recollection at the time is that as soon as Hartford did it, the state of Connecticut passed it. And so we were definitely a leader in changing policy for the entire state. And perhaps with this ordinance, we'll be a leader once again in causing other communities around the state to adopt something similar. And someday maybe we'll return to that flavored tobacco product ban, because I do think it still needs consideration. Just as a total aside, but because it's a very receptive audience, you're obviously thinking about all these things. It was my understanding that there was support in Hartford for passing a flavored ban, but exempting menthol and flavored pipe and cigar tobaccos, if I'm not mistaken.
Yeah.
But the American Cancer Society or the American Heart Association, I think it was the Heart Association, did not want us to do that. They felt very strongly that if we weren't going to go the whole 9 yards, just don't do it, that it was going to hurt their efforts. So I just throw that out there as by way of saying, I suspect that you still have some willing allies here on council if there's something that folks want to bring back to us in that regard.
Yeah, Akeelia and Akeem they were part of the Tobacco 21 legislation when it passed, and they also worked on the flavored products. And they were there, they spoke the evening when it would have passed until the Lung Association decided it should go back as an amendment. And then COVID hit. And when it came back, that's when all the lobbyists and everyone came out. So we, as I said, we've been doing this work for many years, and 2 of the students have been working on it since day one. So we're familiar. And that's why that's why we specifically grandfathered existing stores. And, we're not making this super, restrictive right now.
Well, thank you for that. And one more question, if I may, Mr. Chair. And this is directed to Corp Counsel, since this issue has come up in the past, and that is whether Corp Counsel's had an opportunity to give a look over this ordinance for legality to advise us as to whether it's in a form that's suitable for passage at this time.
Yes, through you, Mr. Chair, LeBron, Mr. Gale, we have had an opportunity to look at this. We believe it would survive any legal challenges based on it being rationally related to public health and safety. We do have a grandfather clause to try not to disrupt existing retailers of tobacco, and it appears to go hand in hand with the age limit, raising the age limit from 18 to 21, specifically in regard to it being in proximity to city schools. We feel confident enough that it would, if somebody were to sue on it, that we would prevail.
Thank you, Mr. Chair.
Thank you. So why don't we have Director, I know we spoke briefly. Any comments at this point, or I know you may reserve for later. It's fine if you don't.
Yeah, I don't have any comments right now. I'm in approval of this. I think that anything that improves the public health is great, and especially to protect our children.
Thank you, Director. And so, Ms. Mirzra.
I would just add that according to the American Cancer Society Cancer Action Network, they have projected that there are 56,000 children in Connecticut aged birth to 17 that are projected to die from smoking if changes are not made to modify current behaviors. And the big tobacco industry spends over $60 million a year marketing to Connecticut residents. And the annual healthcare costs in Connecticut caused directly by smoking is over $2 billion. So we feel strongly that the city of Hartford needs to fight the tobacco industry's influence on our youth by passing this ordinance to protect their health and well-being.
Thank you. And Sharon, do you represent an organization?
I work with the City of Hartford Health and Human Services Department. I am a program manager with the Hartford Healthy Families Initiative, and we've worked closely with Advocacy to Legacy and
Okay,
many of our partners in the community.
thank you very much. And so, Hyacinth, do you want to talk on this ordinance?
Yeah, happy to do that. I do want to speak on another audience, another issue, but I applaud those young people that really work hard and want to push this and want to see this happen. We need to try to get this out more to all the school system. Yeah, it's grandfathered in for people, yes, less than 500 feet across a school or stuff like that. So in a way, I'm saying it's okay to pass this ordinance. However, these people are still there. And what saddens me is to hear the fact that, oh, if we do this, we're gonna close them down. Their business is gonna. So can you tell me that our kids' lives doesn't really matter and their thing is the dollar bottom line? I have a real sad story about that. Okay, we cannot have money over our kids' lives. All right, and we're going to do something. We need to be strong about it, and we're going to fight about it to make sure that doesn't happen. All right, because our children, and as I came there to the council and I speak about the health of our community, the health, I'm talking about people's health. Even with this vaping thing, are we even addressing that issue? Because even though we're talking about, people want to vape, they think it doesn't go to their lungs. It is going to their lungs. And we need to address that. We cannot have a vaping store in every corner of our streets. We have to address that. All right. And so it's important, not only to pass this, but we need to have enforcement. We cannot just pass things and no enforcement behind it. So we need to make sure that funding is available to have someone go out and make sure this is being enforced. That's how it's going to work. All right. It shouldn't be a feel good thing, to say, yeah, we're going to pass this, but to make sure that there is staffing available to address the issue. Okay. So as I said, we need to continue to work, and I'm hoping off a tip of a little, the agenda, we need to address the vaping, we need to address the hair salon and the beauty shops and whatever, barber shops, whatever, to make sure that these people are abiding by the rules. We have things in the books already about that. We need to make sure these things are happening. All right. I need to feel that when I come to that council meeting, I have somebody saying, oh yeah, we're going to need to do something. But again, it goes back to staffing. Because if you don't have the staff, it matters not. Okay? So yeah, I want to applaud those young people for getting that done, and whatever I can do to help, I will continue to advocate. Larry's not around anymore, but he's on phone most time. But I want to support that because the health of our children, our adults are important. As you heard what Sharon said about how much it's costing us for lung disease and all those kind of things. Well, we want to try to prevent this from happening to our young people. Let them see that it's not right. Let's use those young people that we have to go out and spread this story about vaping and smoking. All right, thank you.
Thank you, Hyacinth. So a question is, and I don't know if this is for Attorney Osborne or for the director. Currently, right now, to sell tobacco products, is there a licensing? Do you have to? Let me back up. Let me acknowledge Council President Mally Rosado has joined us. Council President, any statements you would like to make? Okay. So I don't, for Director Jackson Shahid or Attorney Osborne. Currently, right now,
hi, Councilman.
yes,
I'm sorry,
yes.
I was trying to
Madam
mute my
President, yes.
I'm on the I'm on my cell phone.
It's okay.
Yes. So as you know, I have spoken with you prior to this meeting to introduce an amendment to this, including cannabis. And I was just listening to what Hyacinth was saying about the vaping, which I truly agree with her. And one of the scariest things for me, right, when it comes to vaping is that we really need federal laws in place right now. You can get on the internet and order as much vape as you want offline from China, and there's no regulations on that. The enforcement part, absolutely, but we need the bodies to do that. But going back to the ordinance, when I read it, the first statement, which it stated that there had to be a health license, and correct me if I'm wrong, currently it's the alcohol, that if you sell alcohol, you need a health license, not for tobacco. So could we get clarification from that, for that?
Yeah, I was just gonna ask that, Madam President. So, Attorney Osborne and, or Director Jackson Shaheen, do we know, if that's the process now? Do folks who sell tobacco products have to, secure a license on a yearly basis?
If I may, and I apologize, Director. I haven't met you yet, but I'm Attorney Osborne. I'm a science to your committee, and I'll certainly talk to you, offline one day. And congratulations on your new position. So I worked on the original Tobacco 21 legislation when Councilman Deutsch was here, and what happened at the time was the city of Hartford was the only municipality at the time seeking to raise the age to 21. All the tobacco licenses were through the state as of up to the age of 18. So when we created this ordinance, this original Tobacco 21 ordinance, at the time it was, so we have some infrastructure to, make sure we're taking into account that sales must be go up to the age of 21. However, after we passed our ordinance, the state followed suit and they raised the age of 21 as well. So it is my understanding that the tobacco licenses are going through the state. The original intent of the ordinance was, the city was going to monitor it to the extent that we were going to 21 and the state was going to remain at 18. However, the state went to 21. So, my understanding is the state still has the licensing power up until the age of 21.
That's correct.
So if I'm hearing correctly, that the language in the ordinance is moot because the state, you have to go through the state for the tobacco licensing. Would that be correct, Attorney Osborne?
It appears so. Originally, when we enacted it, the city of Hartford was the only thing. So,
Right.
obviously we'd have to do it ourselves.
Right.
But right after we passed it, the state passed it. So the licensing kind of went back to the state.
Got it. So would it make sense for two things? Maybe since it's a moot point, should we strike that language or say something that it pertains to the state? I think Councilman Gale, the attorney in you, was trying to come out. I believe you had your hand up. Did you want to comment on that, Attorney Gale? I mean, Councilman Gale.
Yeah, I mean, I think you raise a great point. It may be that we do need to look at this a little bit in more depth, because I think we can prohibit the sale. But to Corp Counsel's point, I don't think we can affect the licensing if the licensing comes from the state of Connecticut. There is a, I know from having represented a lot of people who bought convenience stores and these types and package stores, you do have a separate license that you get for selling tobacco products. I think it's actually through the Department of Revenue Services, because it's keeping track of the revenue that you have to pay to the state for selling cigarettes. So I don't think we can affect any state license that people
Right.
are receiving, but I do think we can still prohibit the sale of cigarettes within 500 feet of a school. I don't know of any restriction on that. And to Corp Council's point, it sounds like neither did Corp Council. They didn't think that there was any problem with that.
Right. Director?
Yes, I mean, what I want to say is that most stores, though, are mixed use, right? Or they're selling different consumables, and that's where the health department can come in. Because and that's why we usually have some regulation over a store that is selling tobacco. So we do have the ability to give them a license or reject the license, because we often are doing food inspections. So when you are opening up a new store, if you're going to be selling anything that's consumable that people are eating, then we do have, we can regulate that. It's just that the actual license for the actual product itself comes from the state. But the actual business, we are licensing the business to open in a particular area. So, I mean, I don't know. I mean, we can talk about that with the attorney in terms of the language, how we want to readdress the language, but we do have that authority over the actual business.
Okay. And then, okay, so I think that's one thing, but Ms. Violet?
Yeah, I guess my question is, does this have anything to do with zoning also, like the zoning of the stores and what can be sold? Does this have anything to do with the zoning? Because somehow or another they're enforcing it for alcohol.
Director, I think the question was for you.
Yes, it does have something to do with zoning. So, zoning usually gives a permit for a business. So, for instance, if there's an ordinance for, like you said, for alcohol, if it's 500 feet from, I don't know, a children's daycare, then zoning handles that portion of it. And then once everything's zoned in terms of an application for a business, then they come to the health department for the food inspection. So we work hand in hand together.
Mm-hmm.
So zoning lets you know where you can actually have the business, where the business can be located. And then the health department will come in and license the business for what you're selling.
Thank you. Madam President?
Yeah, so two things. So Councilman LeBron, I believe that, and we've had conversations, that your main goal with this ordinance is to prohibit the sale of tobacco within 500 feet from a school. Is that correct?
That is correct, Madam President.
Oh, okay. And I also had conversations with you to amend that ordinance to also include the sale of cannabis. And so my question is, to delete the wording that has to do with, I think it's the first paragraph of what's written in the ordinance, which is a health license, which is not applicable to the sale of tobacco. Like you said, it's regulated through the revenue department. Would that be considered so after making all those changes to this ordinance that's in front of us right now, would that be considered a substantial change?
I think that's a question for Corp Counsel, Attorney Osborne.
Well, I don't think it's greater in scope than what's been previously adopted. I understand the permitting must come from the state, but it's really a matter of location we're talking about, more akin to like a zoning ordinance. Substantial change where it has to go back to full council. I mean, I think we could do an amendment where we can make it work where it doesn't necessarily have to go back to full council. But of course, I'll leave that to you
Right.
guys.
Okay. No. So I have an idea. So what I'm gonna do is I'm gonna share my screen. I'm gonna use Councilman Gale's sharing of this. He likes to do this. So what I'm thinking here is in terms of the language right here, is we can change something here where it says to the state of Connecticut, right? And just make reference to the state of Connecticut, and
Uh-huh.
then add zoning, right? And then here for here where we've made the changes, we can add tobacco and cannabis products here at this level. So I think here we just mentioned the state up here, right? And then here we just add 2 words here for the state of Connecticut. Well, 2 sections here around here. Instead of Hartford, it'll say the state of Connecticut.
Uh-huh.
And then the same thing here, state of Connecticut. And then here we just add cannabis products. And I think that should solve our problem. You know.
Councilman LeBron, through you, if I may.
Yes.
Well, even if, so you're saying, under section 7, oh, you took it off, under section 1790,
Yes, ma'am.
where it says, what does it say, the first line, each retailer?
Yeah, so basically what I'm doing, Madam President, is let me show it to you again. I'm sorry for taking it down. Yes, let me show you again. So I think to adhere and defer to the state of Connecticut for all licensure, right? Instead of it saying the Hartford Department of Health and Human Services, we would say the state of Connecticut, right? Here on this first paragraph. And then here on the second paragraph, we would defer to the state of Connecticut. So that way now it's all on the state for that piece. And then the third piece would be adding cannabis here in addition to tobacco.
But doesn't the Department of Health and Human Services also have something to do with the licenses within the city?
Well, I think it
Not
has
for tobacco.
well, just for zoning purposes. It would be involved in the zoning. And so, but Director Jackson Shahid, you have your hand up. Maybe you were going to answer that.
Actually, I was just going to ask, the language tobacco products, does that include hookah? Is it like assumed that hookah is included in that?
Yeah, because hookah is tobacco, right? I mean, I'm not a hookah expert, but have family who does hookah, and my understanding that it is tobacco.
Okay. No, I'm just asking because
Yeah.
I mean.
Yes, it does.
Okay.
Filters, rolling papers, pipes, e-cigarettes, e-cigars, vape pens, hookahs. It's included in the definition of 1789.
Okay. All right. Madam President, does that suffice?
Well, I still have second thoughts on the second paragraph, because on there it says such licensee shall renew an annual valid period beginning with the license for the first day, and then allow the penalties in this article. I thought I read right, and then it says something about shall immediately return it to the Hartford Department of Health and Human Services. You know, again, the Department of Human and Health Services does regulate the zoning, but they do not regulate a license for the
Yes,
use
ma'am.
of tobacco.
Yeah, Madam President, I hear what you're saying. So I think maybe on the second paragraph, what we can do is we can say such license shall be renewed regularly with the state, right? Whatever their reoccurrence is. So such license shall be renewed with this shall be renewed with state requirements.
And the other thing that I wanted to address, and maybe this is a separate conversation, the last sentence on that paragraph where it refers to, and I've had a lot of people, business owners talk to me, where it says a license shall not be transferred from one retailer to another or from one location to another. I understand the location, but let's say that my husband and I own a tobacco a bodega, and we sell cigarettes, and he passes away. And this is maybe a question for the attorney or greater than, is why couldn't I automatically receive that license?
Well, I'm I can say that that was the intent at the time of the original Tobacco 21 legislation, but I'm certainly willing to look over things at the pleasure of council. I think this is all language that Councilman Deutsch had he was heavy on at the time, but if things have changed, I'm certainly I work for you guys, so I'm certainly willing to look at anything that you guys want me to look at.
So,
Right.
Madam President, it sounds,
I would imagine that the state, right, the state licensing would trump probably anything that we would put into that regulation. I think that's probably.
yeah, I mean, I think in my opinion, if this was already on the books, it doesn't sound like it was being enforced anyway. So,
My understanding, the state had come so fast after we had passed it that we didn't really get a chance to implement it. That was my understanding of what happened. The state literally followed right after us. So.
Right. So I think it's just a matter of cleaning up the language to defer to the state. But Councilman Gale?
Yeah, I just wanted to confirm that, and our director, I believe, has confirmed it, but maybe should be clear about it. This ordinance, when it was passed, anticipated that the Department of Health and Human Services was going to issue a license every year to sell tobacco products. Now, we know you have to have a health license to vend lots of different items in the city of Hartford. But I think Director Jackson Shahid, you would agree, you don't have a separate license just for the sale of tobacco products at this time.
No, we do not.
No, and I think to Corp Counsel Osborne's point, the intention of this when it was passed was that there was going to be a licensing provision, but because the state immediately adopted a statewide ban on the sale of tobacco products to anyone under 21, it was totally unnecessary. So this ordinance sits here, but it's never been
enforceable.
We've never created the licensing because it's never been needed. Now, having said all of that, and hearing Council President wanting to expand this to include cannabis, it almost strikes me that this really is more of a zoning matter than anything else. That this is very much like our zoning regulations that require that there not be the sale of alcohol products within so many feet of a church and of a school. And the only concern I have is that saying it's a zoning ordinance kind of takes it out of our province because we don't get to pass zoning ordinances. The Planning and Zoning Commission gets to pass the zoning ordinances. But I'm wondering, Mr. Chair, rather than us trying to figure all this out here at this committee, if we shouldn't continue it in the committee to next meeting and charge Corp Counsel with going back and taking a real good look at it and coming back and perhaps suggesting to us where the appropriate place would be to put this type of prohibition into our ordinances. And maybe they'll come back and say it belongs in planning and zoning, but maybe they'll come back and say there's some other place where it could fit within our existing ordinance structure.
So
I would
the,
like to make a mention to you, Mr. Chair,
yes,
about monetary. Is there a fine and monetary? I noticed at the bottom line of your paragraph says monetary. It didn't say how much it's gonna be.
yeah, so Hyacinth, so basically there's deference deferring to the state. And so with the language, the major piece of this ordinance that we're trying to tackle is the ability to sell tobacco around the school. So where all of the it strikes me that while we're focusing on this ordinance, although we want to you know pass the resolution to remove it from schools, that if we have this ordinance before us, that we might as well do it right and clean up all the stuff, even though it's older language. We shouldn't, if it's before us, take out all the moot points. This is something that we saw under charter review, where we removed a lot of language that didn't apply. So there's language here that doesn't apply, and so I think that we should move it. And so, with the spirit of what we're trying to do is just not being able to sell it in front of schools. So, because there was moot language in here, I guess the next question, Attorney Osborne, how fast can we have that language prior to our public hearing? We have a public hearing scheduled on June 20th.
I can get on it as soon as tomorrow.
Okay.
And hope to, today's the 5th. Hope to have you something by this Friday, or would that be too late?
No, that'd be great, because I just want to just make sure that the language is updated for the public hearing.
Yes.
Okay.
And just to be clear with everybody, when the original Tobacco 21 ordinance passed, it was really, the city of Hartford enforcing that piece, and then the state took over. So we were kind of battling with these, whole preemption thing, and Larry Deutsch is very big on this. I think the preemption problem is a little lessened in here. I mean, we're saying even if the state is giving out the licenses, we want in the city them not to be issued within 500 feet of our schools. So I think that's a good correlation. And I'll certainly work on it and try to get back to you this Friday, Councilman.
Fantastic. So since we don't have any recommendations on the what the changes are, Ms. Violet, I just want to just speak to the groups and the folks that are in favor of the 500. I just want to state that what I'm thinking we should do is that make sure that we have the language. If we're going to do it, we might as well do it right, and make sure that we don't have any moot language, because then what we'll be doing is anticipating someone in the future to do the job that we very well should be doing now. And so what I would say is that we would have the language done, and then we'll present that for public hearing. So based upon that, I'll take a motion, or the chair will entertain a motion from the floor.
I'll move to postpone this to the next meeting of this committee at this time.
I'll second that.
All right, we have a motion that's been postponed and properly second. All in favor say aye.
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 Aye. Any opposed? All right, seeing none, let the record reflect that we are postponing it. But Lydia, in the note, Ms. Colon, in the notes, let's just make sure that in our report that we're accurately stating as to why we're postponing. We're not postponing the spirit of what we're trying to do here. We're postponing the legal the legal language to remove all moot points as it refers to licensing by the city, and give deference to the state. Okay. Yes, Councilwoman Rossetti.
And kudos to Attorney Osborne, really
Yes.
No,
On the
getting our
fly.
thinking, getting our
Yeah.
thinking. Thank you.
Yes,
No.
on the fly. Definitely. We got a lot of talented people here in Hartford.
Thank you, Councilwoman and Councilman.
Yeah, a lot of Hartford success stories here. So, Ms. Violet?
So does this mean it's coming back to your committee after it's been reworded?
No, ma'am. I think what we can do is, since it isn't substantive changes and we're taking out moot points anyway, where the spirit of it is around the 500, the ordinance in general. So we could move this along, but as long as the language is uploaded and Lydia posted and the town clerk posted in time for public hearing.
Okay, thank you.
Yeah, so there isn't a pause on the trajectory of this ordinance.
Thank you.
No problem. And we'll send it to you hot as soon as we get it.
Thank you.
Yes. Okay. All right. With that being said, seeing no other items on the floor, thank you everyone for attending today's meeting. Very important meeting, and all have a good night. Peace and love.
Night.